And still ahead, we're looking at Ghanaian nurses. In recent years, Ghanaian nurses have been the target of many issues. They have a lot confronting them. And of course, you've seen the recent back and forth between doctors and nurses. We'll discuss all of that, the brain drain and other concerns emerging, including their base pay as well. We'll talk all about that and more right here on The Pulse, but we'll do that after this break. Please stay with us. And you're welcome back to The Pulse. In recent years, Ghanaian nurses have been the target of many Western nations who've designed programs and policies to deliberately attract them to work there. They find, nurses in Ghana to be highly trained, efficient, and don't have to be paid more than nurses trained in those countries as well. The attraction for our nurses have been, better life for themselves and their children. And in our quest to understand this situation, we're taking a look at the state of the Ghanaian nurse and the midwife as well. In studio with me now is President of the Union of Professional Nurses and Midwives Ghana, Maxwell Odroyeboah. We're having a conversation on this, and Max, it's a good time to be talking to you. Happy New Year.
Oh, thank you.
I hope the year is starting off well for you, the nurses. You're asking for more pay.
Yes.
But I hope it will come soon.
yes, we are hoping so. I think negotiations is still ongoing, so hopefully we are going to have more.
Let's talk about the condition of the Ghanaian nurse and the midwife as we speak today. How would you describe that?
Yeah, so for now, I would say it's not so bad, it's not so good either, because we want more, because we are doing relatively more, and we are even doing better than other health professionals or other health professionals outside the country. Yeah, so we obviously want better conditions of service, and we want more salaries as well.
But then we know of the unions asking for an increment in the base pay and the need to pay more. Why is there a need? Why do we need more motivation for these health professionals?
Yeah, so motivation is key in every job that one does. So without motivation, you would, not obviously give up your best. And so if we want the best out of these nurses, we want the best professionals to perform, then obviously we have to remunerate them better. And so they deserve better. And unfortunately for us, we have, just as you rightly said in the introduction, other countries who are paying much better. So if we don't really remunerate ourselves better, we're going to have a lot of the people leaving.
Also, that's happening already.
It's already happening.
A lot of nurses don't want to be in the country, so they take the certificates and move out.
Yes.
And what's even, attracting, the Western nations, those in Europe especially, for them to ask for Ghanaian nurses and for them to want professionals to come and work there? Is it simply because it's cheap labor, or what else is there to it?
No, not at all. It's actually got nothing to do with cheap labor. Ghanaian nurses are really, really hardworking and very, very professional. If you go to our wards, despite the issues that we have with some patients and patient relatives, if you visit our wards, the sort of professionalism you'd see there from trained nurses is exceptional. And so when most of these people travel outside the country, their services are, superb. And so you have other countries there where you notice that most of the time they prefer the Ghanaian nurses to take care of them. There are certain patients, we have friends there who tell us that, oh, for this particular patient, he says, I want a Ghanaian nurse.
I'm sure you're just not promoting the Ghanaian nurse because, for instance, comparison has been made to the Ghanaian nurse here in Ghana and those in Togo, those in the UK and elsewhere. Where do we even stand, for instance, comparatively speaking?
Comparatively speaking, in fact, we are very high on the ladder. We are very high because this is actually a fact. And so even if you go online, most of the times when they are giving criteria for selection, sometimes they say they want West African nurses, specifically Ghanaian nurses and midwives. It means we are doing something exceptional. And when the people are out there, they give up their best. When Ghanaians are out of the country, their services...
But why don't they have a lot of love at home? And you get to hear the refrain, oh, this is a Ghanaian nurse. You know that some of the comments, the barrage of attacks that you come under, simply because the feeling is you don't treat our people well. Is that the fair description to put across?
No, not really. We actually put up our best in the world as well. The only challenge I really see here is that we don't have enough of the resources that we really need to take care of the patient here. And obviously the motivation is not also there because mostly everybody wants to be paid for the services he or she is rendering. So obviously if you are not being paid as you expect, the motivation goes down a bit. And then if you don't have the necessary gadgets, the necessary tools to work with, that can also affect, your performance. But we do our best in the world and we give off our best. Fortunately, I am still working in the world. I haven't moved out of the world. I still go to work. Oh. And so I really know what I'm talking about.
In fact, that brings up the conversation about the alleged friction between doctors and nurses. Is that a reality, given what's happened, for instance, in the Ashanti region? You saw that backlash at the Mensha hospital, where, of course, many say that's just a tip of the iceberg, something really deep-seated within the medical space which needs urgent attention. Would you say that we're dealing with the root causes?
No, not necessarily. For me, as I already stated, I've worked in the world my entire life. I have refused to go to the classroom to teach. After my master's degree, I was asked to go and teach. I said, no, I'm staying in the world. Right. The world, the patients also deserve the best. So we don't really have a lot of problems with the medical doctors. What we see is that we have exceptions in every case. Some nurses are slightly disrespectful. You have doctors that are disrespectful as well. So when that, those two people come together, obviously you're going to have that friction. But the majority of nurses and midwives work in harmony. And I have worked with different doctors, different nurses, and I can't remember any doctor who has actually had an issue with me. They respect me so much. I also give them the same respect, and we work as a team.
Okay. The year is starting. I asked how most of your members were doing, but clearly I'm not sure you would say it's a good story, because it started off late last year when we're seeing, of course, the back and forth in terms of the negotiations for the base pay. You've been up and down, in and out of the negotiation room, and yet we're not getting closer to having a full deal. What you've been part of the negotiations as well. What's that difficulty? Government says, for instance, the Deputy Labour Relations Minister indicating that he's fed up. I mean, he simply doesn't know what your concerns are. Government is giving you an option, and yet you won't budge, you won't give in. What's the problem?
Yeah, so government is tabling one thing, organized labor is also tabling another. So that's why we keep telling them that it's a negotiation. So they don't expect us to just accept whatever they have brought and then we are happy with it. We don't also expect them to accept whatever we've brought. But we expect to have a compromise, something that is realistic. Just yesterday from Joy News, inflation is about 54.1. Our salaries have remained same from last year. So obviously they need to also understand that conditions have changed. Prices of goods and services have changed. So if we don't change with time, obviously we are going to have this huge issue of brain drain coming again. And so they also have to be a little bit compromising. and accept some of our terms. It's not that we are demanding so much, but they just have to be reasonable.
Do you have options on the table? We've heard from some other groups indicate to us that, look, if this doesn't go through by so and so date, we'll go ahead, we'll strike, we'll withdraw our services. What do you have on the table if the worst happens?
If the worst happens, we speak the language the government understands best. Fortunately, we are behind organized labor in all that they are doing. So whatever action they request of us, we're going to follow it, and we'll follow it to the latter. We just pray we don't get there, because we are not asking for so much from government.
There are concerns also about some other policy measures which you feel government needs to urgently address so as to cushion the nest some more. What are some of them? What's top on that agenda for you?
Yeah, so for us, we would table a lot of these things when we go into the negotiations for nurses and midwives, maybe later on after the base pay. But we are asking for a few things, maybe improved conditions of service such as extra duty allowance improvement. Maybe we would look to revise our base, our salaries, and then even the main things that we work with, especially our safeties in the hospitals. If some of these personal protective equipment and those things are not provided at the facilities, it goes a long way to affect our performance as well. So when we get to the negotiation specifically for nurses and midwives, we have a whole lot of things that will be presented to them.
And is government willing to negotiate on that score? Because already if the base pay is giving you a challenge, then you have a really long way to go.
Yeah, well, we hope that they would listen. I think one of the main things government is worried about currently is the numbers under organized labor, and how much they would have to dole out if they increase to a certain percentage. But if you come to nurses and midwives, we are not so many. So we believe that the few things that we will table to government, he will be willing to, look into it for us.
So some argue that you don't have that full front, united front, if we may call it as such, in pushing through your demands. There's the GRNMA working on one side, and you have the Union of Professional Nurses and Midwives also working on another hand. I mean, what's the unique story to yours for which you are not willing to perhaps work together with them? Or what's the story of your side, which is the Union of Professional Nurses and Midwives? Do you have peculiar challenges?
Not really. We are actually, supposed to be collaborating with the GRNMA. The laws of the country even, force us to do so. The challenge here is that one union broke away from the other. The UPNMG came out of the GRNMA. So obviously you expect that friction to be between us. But that notwithstanding, in times past, we've been able to do one or two things together. Especially when it comes to negotiations, we have no option than to go along with them because they currently hold a collective bargaining certificate. So we are open to working with them. But obviously, you understand once somebody comes out of another group, there's definitely going to be a friction. Initially, they probably felt the group was not going to survive, and so they could frustrate. And
but your composition is still thriving.
Thriving, and in just about 3 years, we're taking about 1/3 to 2/3 of their membership. So it means people are really...
Is it sort of a competition or just a case of trying to get better welfare for the nursing fraternity?
Excellent question. So I've always insisted that it's not a competition between two groups. Because ultimately, we have somebody who is here and the wife is in another group. And so it's never going to be a competition. At the end of the day, the employer is the one that you're going to make the demand from. The main reason for the formation of UPNMG was probably just to better the condition of service and then provide different welfare policies for the nurse and midwives. And we've actually executed that perfectly. And that's one reason why we keep going. Because I said this to somebody and he was very surprised. Nurses and midwives work in the hospital. They have no insurance cover in the hospital.
As we speak?
As we speak. So when a nurse falls sick, he pays for every medicine, every drug he picks from the hospital.
No cover at all?
No cover. You pay for all the labs that you go to in your own facility. there's no free thing for you in your facility.
For how long have you been fighting this?
We've been talking about this, we've been battling this, and nobody seems to care.
Right.
So UPNMG decided that, okay, well, so we take matters into our own hands. We're going to provide an insurance policy for all our members at no cost to them, because we believe that's why they pay dues to the union, to be innovative, to provide for them, and to protect them when they need be. So that's exactly what we're doing. And these are some of the main policies we're bringing up that, you know, causing the growth of our members.
And in fact, since we're on this subject of cushioning the nurse and trying to avoid brain drain, government announced a policy measure recently about training or exporting some nurses out of the country. You've taken notice of that. Have you been engaged as a group? And what professional advice did you give to government on that?
Thank you. So on the brain drain and the export of nurses, in fact, it's been one of our main policies when we started working. And I think from the beginning, around 2018, 2019, we engaged government. And we proposed to them that the export of nurses was going to bring in some foreign exchange that could help government. And we gave them our own proposal on the sort of, or the criteria they should use to select these nurses, because most of the foreign countries wanted our specialists and consultants, the experts. So we felt that, no, if we could have a proper staff mix in our hospitals, then you don't have to push all the professionals or the specialists out of the country. So we've had a few engagements with them, and then we're hoping that they would listen. As for the export, people are already going. In fact, just last month alone, from our data, we lost about 520 people who had vacated posts, and we obviously knew they were going outside the country. So they are going. How can the country leverage on their going and also get something back? And once the country is aware of how many people are going, obviously they will be able to make provision to employ more. As we speak, since 2019, we have trained nurses who are still in their house unemployed.
Right.
And we keep making a case for them, for government to consider employing them. So if the opportunity has come for some people to go, we believe that fine, let's push some.
Okay, so what you're advising now is that let's focus on those who are at home, those who have not been taken into the system, either take them into the system and let those serving currently in the hospitals be transferred abroad.
Not all of them.
Okay.
Yeah, so if
To a
we
mix.
have a proper mix, because those who are staying home currently have completed, most of them, 1 year mandatory rotation, and some are still working in the hospitals. So they have the experience that these foreign agencies and foreign countries need. So if we can take some of them, mix with a few specialists and go. So we continue to maintain a proper staff mix at our facility, so that when I'm also sick, I go there, I know that I have the right people to take care of me. So for us, we don't have a problem. We think it's a good deal.
We're looking forward to the future. At least negotiations will continue. What's your hope and the hope of your members as you resume talks?
Yeah, so we are hoping government would be considerate.
60%?
60% would have been
amazing.
Yes, would
yeah,
have been
but it's not looking likely.
Not looking likely. I think from yesterday they've brought it down a bit. We are also changing our position a bit. It's frustrating when negotiations, prolong for a while.
Right.
But we believe that it's in our interest, their interest and ours, because if we lay down our tools, it favors nobody.
Yeah.
Yeah. So we believe that they would,
do some things. but your assurance to the general public as a wrap up on professionalism of the nurse and continuous service delivery at the highest standard. We need that from our nurses, don't we?
Yes, we do. And the nurses are poised, to perform. If we get the right tools, we get the right motivation, and we get the right union backing as well. So at UPNMG, we believe in improving the professional practice of nurses and midwives. So we have CPD trainings we organize for them. We have scholarship scheme for members who want to, further their education. And then we have the protections for them. We have loan schemes for them. Those who want to go to school who need money and so on and so forth. So we believe that, we are going to improve professionalism, and the union has a great role to play.
Well, the future is looking bright. We can only wish you the best. Thank you for joining us here on The Pulse. That's Maxwell Odroyeboah. He's president of the Union of Professional Nurses and Midwives. But